Good afternoon. My name is Mike David. Can you say your name for the record, please?
Good afternoon, Mike. My name is Lisa Spencer.
And what is your candidate number, please?
My candidate number is 21055266642.
Thank you. And you are taking this test as a nurse, is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. As staff nurse position, how would your coworkers describe you?
Well, my colleagues will tell you, they can count on me. They will tell you that I am a team player, and someone they enjoy working with.
What can you tell me about teamwork as part of the job?
There is usually a team of staff nurses, working in cooperation with each other. A team of nurses has to get along well, and coordinate their actions, usually by dividing their responsibilities into sectors or specific activities. They help each other perform tasks requiring more than one person.
How is patient progress monitored by a staff nurse?
Nurses monitor vital signs and look for symptoms of potential illness. We chart progress for the use by other nurses and physicians. Nurses report progress to physicians on duty.
In what cases does a staff nurse contact the patient's family members?
Family members are contacted during emergencies. At other times, family members are informed on the patient's progress. Nurses consult with the family to decide on the best course of treatment for the patient.
What personal characteristics should a staff nurse possess to be good at the job?
It is important to be organized and have a good memory. A nurse performs the duties quickly, on time, and efficiently. Nurses are sensitive and pleasant with others. Nurses' attitude must not be to simply administer technical treatment mechanically, but to make patients feel as comfortable as possible.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the first role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hi, good morning, Mika. How are you feeling today?
Good morning, nurse. I'm feeling good today. And you?
I'm doing great. Thank you for asking. Well, Mika, I came to know that you love to stay here with us, and are not willing to go home, even. You have received the discharge note.
Absolutely, nurse. I feel safe and very comfortable being here. I don't wish to get discharged.
That is really interesting to hear. Most of the patient wants to get discharged soon, and wishes not to visit the hospital again. Mika, I'm very curious to hear from you the reason why you said so.
If I'm at home, I'll be alone during the daytime. I fear getting sick while I'm alone at home. I feel safer here in the hospital than being at home alone.
I wonder why you want to get worried about getting sick again. You are perfectly all right. The doctor gave you the discharge just because your health is satisfactory.
Okay. But, you know, when I'm here in the hospital, I can mingle with different personalities. Moreover, thanks to the nurses and the doctor, whose care makes me much happier to stay here with you all.
Well, thank you for your good words. While at the hospital, getting a chance to mingle with others might be right. But what about spending time with your daughter and her husband? Your grandchildren are waiting for you.
I wish they could be here. During the daytime, they will leave to work and children will go to school. I feel lonely.
I understand you, Mika. Don't get upset. You may feel alone during the daytime, but your family needs you to be at home. They really miss you. Your presences are much vital, and grandchildren need your loving care.
I miss them too. But the thing is, I fear getting sick again while I am alone at home. That's why I feel safer and wish to be here in the hospital.
Mika, I assure you that you are perfectly all right. You are healthy right now. There is no room to get worried about getting sick again. Else, the doctor won't give you the discharge.
All right. I trust that. But
caring at hospital cannot be compared to the care and love at home from your dear ones. It's our duty to provide medications and prepare the patient progress.
yes, I'm not comparing hospital and home. It's my fear of being alone and the feedback about the hospital.
I acknowledge that. Actually, hospitals are a place where you have more restrictions. When you are sick, you are at bed rest. But after getting cured, everyone wishes to have the freedom of mobility, which is not permitted in the hospital.
I accept that.
Not only that, you have restrictions for all the freedom you enjoy while you are at home.
That is true, nurse.
Mika, you are perfectly all right. You don't even have any medications to be energetic and return back to your normal life.
Sure, nurse.
Your grandchildren need your care and love. Your daughter and son-in-law needs your guidance and support. Being the eldest member of the house, you have some responsibilities. Cheer up, Mika. Be with your family and enjoy each and every moment with them.
You are absolutely right, nurse. I'll be more energetic as before. I'll live with my family happily.
That's great. I'm so happy to hear that.
Thank you, nurse, for the time and your words.
It's my pleasure, Mika. So get ready to go home. I wish you a very happy and healthy life with your family.
Thank you very much.
Bye. Take care.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.